leads to high cholesterol and high blood pressure. Now, if you add chromium polynicotinate, what we're talking about today, into your body by taking it in a pill form, you pour it in there, you see what happens? It mixes it, doesn't do a lot on the surface, but what it does do is help stabilize insulin, and for that reason stabilize your blood sugar. Without too much blood sugar, when you pour those nutrients into your body doesn't store it as fat anymore, it converts it to energy. It seeps through like it's supposed to, and just what we did before, we repeat, but this time, all that stuff goes down into your body to be used to generate more energy. Without those high insulin levels, you don't wreak havoc in your body for a bunch of reasons as well. So Dr. Chen, I just demonstrated, I think pretty graphically, what happens when we add chromium to our diet. But in clinical practice, when you take care of your patients, people who have diabetes or borderline diabetes, when you give them chromium polynicotinate, what happens to those numbers?
Well, I've actually seen in my own patients in my own clinic that with diet, exercise, and the chromium, when they're deficient, they're really able to get blood sugars from the pre-diabetes stage down into the normal range. So we're talking about sugars about the 110s down into the 80s or 90s. And so that really lowers your risk for diabetes, which is huge.
And there's another benefit of chromium.
Yes.
I hinted to it, but this is the real reason many of you will be interested in it. Go ahead and share it.
So what's exciting is we've seen in the studies that when you're deficient in chromium and you take it, it actually helps promote muscle gain and to decrease fat, which ultimately, to put it simply, really is to help somebody lose weight faster and to maintain the weight loss longer. I do have patients in my clinic where we recommend diet and exercise, obviously, and we also add in chromium polynicotinate. And with these patients, we've seen weight losses up to about 70 pounds over the course of months, because ultimately what you're looking at is a more efficient way of losing weight. So a good analogy would be saying someone trying to lose weight on chromium when they're deficient is like cooking on a stove, versus without chromium when you're deficient is like really trying to cook with sticks and matches, not as efficient.
Right. So there are several forms of chromium that we can buy. What should folks be looking for to get the right stuff?
Well, chromium polynicotinate is the type that we tend to want patients to take because it's seen in the studies to be safer and more well-tolerated. The polynicotinate part of it is actually niacin B3, which actually helps with cholesterol and triglycerides, so you get added benefits with it.
How much do you take?
So you take about 200 micrograms a day, and you want to take it before or during meals, but if you do forget, you can go ahead and take it after the meals. But you don't want to take it with your medications or other vitamins because it blocks absorption, and that doesn't work as well.
And side effects, things we should be worried about?
Generally, at the recommended dosing, it should be rare, and I don't personally see a lot of side effects with that. But if you take higher dosages, we are looking at potentially skin flushing, rash, nausea, so don't do that. And if you are diabetic and you're on diabetic medications, because the chromium makes your insulin work better just naturally, you may want to dose change the medications with your doctor to make sure that you don't, because you may not need as much, so that you're not over treating yourself.